Morning, can you hear me?
Yes, I can hear you.
Can you still hear me? My phone's not working properly.
I can hear you.
Okay, thank you. Natish, I'm glad you made it this time. Nice to see our invite
Thanks.
system worked.
Yes.
I
There were a
almost
couple
didn't
times
make
there
it
where I just
myself.
was like, what happened? Yeah, a couple times.
I don't have any audio.
This is Doug. I can hear you.
I can hear you too.
There, I'm muted. So now they can't hear me. They can see me, but not hear me.
Here's the wall for the clubhouse.
Okay,
This is the pro shop area, so a door coming in there. Then there's a door coming in here that you can go over to the bar, and a door coming in here that you can go over to the bar and restaurant area. I think this is like a staircase. There's some bushes here. This is all paved in through here, and then out here there's grass area, and then there's a big driveway on this side yet.
We can hear you. Now you're muted.
Can you hear me now?
Hi, Lois.
Yes.
Hi, how are you? Okay.
I'm
I
good.
couldn't get any audio for a long time.
Oh, that's not good.
Well, I hear you now, so I can hear you. I don't know if there's anybody else there.
I think the rest are all muted right now,
Okay.
except Kim.
I can hear you both. Hopefully you can hear me because I wasn't able to use my phone to call in.
Yep, we can hear you.
It's a nice, bright, sunny day.
It is.
Yeah. I got all my shades pulled and I still have a bright
I see that.
halo.
Oh, that's just a halo because you're a perfect little angel.
Oh, yeah. Oh, yeah. Well, thank you, Chris. I like the way you lie.
I've had a lot of practice.
Or fairy tales.
Yeah. Oh, I just finished a book about fairies.
Oh, did you really?
Yeah.
I
Back
saw
in
some.
the late 1917, right before World War One.
Oh,
And this is actually based on a true story about two young girls who had photographs taken of them and some fairies.
ooh.
And at the time, all the experts were saying they were real. And the girls had drawn them and cut them out and took photographs in this place with fairies, and it's a kind of a cute story, where basically it's people wanting to believe that there's magic in the world when you have a war going on and everything looks so dire, and
Must have
people
been
are
a
dying.
fun book.
Yeah, it was very
Yeah.
interesting.
I saw that those knots that are on horses in their mane
Yeah.
those are the fairies at night. They're braiding them.
Oh, really?
Yeah.
Yeah, I love it. A little bit of magic to believe in is a good thing.
You-
Nothing
you
wrong
bet.
with that.
You bet. I don't know. I only see you, and when I try to get everybody else on, I don't see them.
For me, there was a knob that said gallery view.
Oh, yeah, that's right. Or let me find that. Don't see that.
Well, that's what my iPad shows. I don't know what your computer would show if.
It's my iPad.
Oh, it is. Okay.
Yeah, when I click on all the panelists, all I see is their name, whether they're muted or on video.
Oh,
I know there is a gallery view, but I don't know how to find it today. No, that's that.
Give it a kick, it might help. You know, like when you kick tires on
Yeah.
cars.
We used to bang on the TV, remember, at the
Yeah.
top when it would ride. Boy, we're showing our age, huh?
I know, that's what I was thinking too.
No. I know it's in here somewhere. There we go. Now I'm in gallery.
Oh, there you go. Where's Don this morning?
Thought he was going to be here.
Oh,
I haven't heard from him, so I was assuming he'd be here.
Ooh. Ooh. I can't, everybody's muted but me?
Okay, I made a call to Don. It went to voicemail, but I left him a message. I don't know.
Oh,
He didn't pick up.
How long do we give it with him not showing up?
I don't know. Who is there a vice chair on this committee? I don't even.
I thought it was
remember.
you, but maybe that was in the past.
Well, why don't we, you want me to do that? I can do that.
Yeah, I mean, I thought you were the co-chair, but if you're not, then I could be wrong. That's what we've got written on spreadsheets. If we're able to start it without him,
Yeah, there's no, he can, if he pops in, he can certainly take over at that point.
okay. Why
All right.
don't you go ahead and start it?
All right. Well, then I'll call the joint Washington Ozaki Board of Health meeting to order. This affidavit was posted in the office of the county clerk on the 2nd day of September 2021. Notice was sent to the West Bend Daily News, WIBD, WMBZ Radio, WTKM Radio, Express News, My Community Now, Hartford Times Press, Kewaskum Statesman, Milwaukee Journal Sentinel. All right, with that, the first item on our agenda are the minutes of May 14th. I would entertain a motion to approve. So you need to unmute yourself, people, if you want to say something. All
Move.
right, is there a second? That was
I'll second.
Kathy?
Yep.
Was that you? Okay. So we have a motion and a second. Any discussion, corrections? All those in favor of those minutes, please signify by saying aye.
Aye.
Opposed? And that motion carries. All right. And the next item is the COVID-19 update.
Okay, so our COVID update for today, our burden is still high in both counties. Ozaki is seeing a bit of a decreasing trajectory. Washington County is still increasing. Again, the trajectory is the percent positivity rate of the tests that are being done. Some good news along with that, though, our transmission level in both counties is decreasing a little bit recently. If you look at our chart on our data dashboard, you'll see that our line graph is actually heading downward towards the substantial level, which is good news for both counties. There's another update we did on our data dashboard that we've been discussing for months now. We put our hospitalization rate back up there. We've had some discussion about the relevancy of that. So you'll see that currently in the last 30 days, Ozaki County has had 21 hospitalizations and Washington County has had 18. So that's definitely increased over the summer. It's a number that we're watching. We're hoping it doesn't continue to increase. It seems like it's maybe plateauing a little bit for now, but we'll see. I'm sure maybe Dr. Zills has some more thoughts on that at some point. As far as vaccine rates go, we are at 62.6% of Ozaki County residents who have received at least one dose of the vaccine. Ages 12 to 15, we're at 57.6%, and 16 to 17-year-olds, we're at 64.6%. In Washington County, we're still lagging a little bit behind, but the good news is we finally hit 50% for the total population in Washington County this past week for at least one dose. 12 to 15-year-olds are at 31.6%, and 16 to 17-year-olds are at 37.5%. So we're working on getting vaccine clinics up and running for boosters if they're needed as early as September 20th in both counties at various sites through some of our local partners, Oasis and Midland. They've done some of our clinics with us in the past, so we have a good relationship with them. And then another thing we've been ramping up recently is our COVID testing at our curative sites. Those are the blue vans that we've had at the Washington and Ozaki County Fairgrounds. They pulled out of the contract earlier this summer due to the decrease in cases, and they've recently agreed to step back in and join us back at both of our sites again. So as of right now, they are in both counties on Mondays and Wednesdays, and they just agreed this week to potentially add a few more days per week. I'm not sure exactly what that schedule is going to look like, but within the next week or so, they should be there more than 2 days a week, which will be helpful for the availability of testing in both of our counties. What was that?
I have one question. If
Sure.
you are older and it's my understanding that that makes you eligible for the booster shot?
As of right now, I believe if you have any kind of immunocompromisation, you are able to get a booster if you're immunocompromised. But for the general public, I believe September 20th is still the date that we're looking at for opening it up. So we've been advising so far to have people talk to their personal provider and see if their doctor would recommend getting it as of right now.
All right.
Yeah, that's correct, Kim. The recommendations right now are only if you're immunosuppressed. So if you're on chemotherapy as a cancer patient, or if you're on any kind of other immunosuppressant medications, maybe for rheumatoid arthritis or things like that, you're eligible. Age is not a factor at this point.
Okay.
And the one other comment that I would say is we'll see what happens with the boosters. It looks like perhaps those might be delayed. There was some federal political things going on, and it may have been premature to throw for the federal government to throw the September 20th date out there. So I just wanted to put that out there for everybody. Don't necessarily count on the September 20th. It may be pushed back a little bit from that.
Okay.
Yeah, we're preparing ourselves to do clinics as early as that if needed. But yes, it is a big meeting at this point.
Good.
Kim, do you have any idea of the 30 individuals who are hospitalized now, ages? Are there any children in that group?
I don't know exactly what the ages are, the breakdown. I don't know if Dr. Zills has any more insight on that. I don't think there's a lot of children.
I can speak just anecdotally from what we're seeing at Grafton, just from what I'm I'm in the emergency department practicing. I have not seen any children. We are seeing a decent number of younger individuals. So it seemed like, you know, when COVID first happened, it was mainly affecting the elderly. Now it seems that we're seeing more 40, 50-year-olds, I would say, that are being hospitalized for COVID. Not exactly sure why that is. I mean, I know our vaccination rates for 65 and older are outstanding, so that may be part of the reason. I've also read some things that the Delta variant is tending to affect younger folks more in general as well. So, but that's what we're seeing. We're still seeing some elderly people affected, but mainly it seems to be more the 40, 50-year-olds that we're seeing.
And are they vaccinated or unvaccinated?
90% of them are unvaccinated.
Okay, now I know I interrupted you, Kim, so if you have anything else, please speak
No,
up.
I was actually about to say that's pretty much the rest of my update. So unless you have any other questions.
Any other questions from anyone?
This is Nitish. I don't have a question, but really, well, I guess maybe it is a question. I've been in some webinars where the Wisconsin DHS and the CDC at the federal level are really pushing for flu vaccines and COVID vaccines to be given together when possible. Just if patients are coming in, if people are coming in for one, they should really try to get them to get both. So I don't know if there's anything as a Board of Health or as the Combined Health Department, if there is anything we can do to promote that.
We can certainly promote that. We typically promote the flu vaccine around this time of year anyway. It makes sense to incorporate them both into one post. Yeah.
Yeah, and part of that promotion that they're doing is that they can be given at exactly the same time, just in different injection sites, obviously.
Yep, absolutely.
Well, it's good information to share for those who are watching us on YouTube, so thank you. All right, then the next item is communicable disease update.
Okay, so I've sent out our communicable disease report as usual with the board packet. I guess we can start it off if any of you have any questions or concerns, anything that stood out to you this time. Unfortunately, I don't have our communicable disease nurse, Carolee, with us today. So if you have any super tough questions, I may or may not be able to answer.
Okay. I don't hear anything.
No.
Everybody's muted, so I guess we're good to go on that one. Then our next item is the Wic Program update.
So the Wic update for this this month is fairly brief. The only big updates are that the Wic waiver, which we were given quite a long time ago to see clients in person, was extended again. So we, at the very earliest, don't have to see people in the office until November, which our Wic clients are really enjoying. They're making it to their virtual appointments much more easily for a variety of reasons. So that's been really helping us with our numbers, and our Wic staff have been fantastic. They've found all kinds of really great ways to provide their services virtually and to shorten the process. So this has actually been one of the positives that has come to our department out of COVID. Another thing that you'll see on our update for Wic is that this summer, there was a temporary increase in the fruits and vegetable dollars that were provided to each individual that's in the Wic program throughout the summer. So that's going to be decreasing again soon, but that was really exciting for our families. They were able to get a lot of fruits and vegetables all summer long for their families.
Great.
Questions about Wic?
Okay. Then our next item is the 2022 budget, and this is for discussion only.
Okay, so our budget looks a little bit, the presentation of it looks a little bit different this year. I've been working with our budget manager, the county budget manager, on trying to pull some good reports for you, and it wasn't working really great for some reason. So I was able to pull a few things for you for now. As of right now, our plan, just to give you a little background, I usually do the budget. I'm typically the business manager when I'm not the interim health officer. So this is my 5th budget with the department. Some of you may have heard me present them in the past, some of you maybe not. So this year, our goal really is just to maintain status quo into 2022. Our budget is kind of up in the air. We have a lot of COVID funding that's coming in from the federal government that's helping us to offset some of our additional costs. And we've had just a lot of change with our staffing and our needs just to focus on COVID response. So I didn't feel that it was necessarily a strong need for our department to change our regular staffing at all. So you won't see any big expansion requests for staffing or changes to our organizational chart, but we do have a continued increase in our COVID funding that is helping us to pay our ongoing contact tracing staff and a couple of additional office support staff, and then a couple of strategists that we added with COVID funding last year. So those are all still in the budget for next year, which allowed us to continue having a flat levy for next year. So you won't see any increase requests, which is great. Just to give you a little bit of an idea of how much we've spent on COVID, as of this year, we've spent a little bit over $800,000 on our COVID response. That's since January. And we were given $2.5 million to go through next 2022 October. So I think we're well on track to spend that money, but not go above it. But that's really our big focus for the 2022 budget. I don't have any big changes in there other than that. But I wanted to present it to you just in case you have any questions or things that you want to talk about.
I
Any questions?
I have a question. I do.
Go ahead.
I know that last year, and that last year was my first year on this committee. This is only in summary. And I guess we were looking for something more than just a summary. You have some significant increases in expenses. And I don't know if you just took it from where you have your revenues coming in and then you plug a figure in and say, we're going to spend it all. But you have a $72 million, is that 72 million? Yeah, dollar increase in.
I'm not sure what you're looking at. We don't have a $72 million increase.
Well, I'm looking at expenditures and I see the 2022 as 2,435,654. I'm sorry, it's 70. Is it 72,000? I'm looking at the PH tax split 60-40. So I see how you're doing the tax split, but it's only a summary of total expenditures, and I don't see anything behind that. And I know we had an issue when it came to Washington County finally approving the budget in our Human Services Department because there wasn't any detail behind it.
The detail typically goes to Ozaki's Human Services Committee and the Finance Committee in Ozaki, and then the Ozaki Board. They are our fiscal agent, so that's why the Washington County Human Services Committee doesn't see detail. They just see typically the levy portion of what they agree to pay. It's kind of like a contracted service to Washington County. I'm not sure what number you're looking at on our chart. I'm seeing total expenditures for 2022 proposed is $2,425,654.
Yeah, and my mistake, it was $72,000 increase in total expenditures. So, I know that it was an issue when it came to Washington County. We wanted to see the same detail that you're seeing in Ozaki County, and a number of people did not want to approve it without that detail that you see in Ozaki County. I mean, we're just expected to approve whatever Ozaki says it's going to be.
It might be part of the contract that we have with them. I'm not sure about that, but
yeah, to some degree, that part of it is out of my hands. I mean, it's typically those reports that are sent to Washington County are provided by the county. They're not reports that I run or pick. And the reports I have today, unfortunately, I wanted to give more detail, and we were having a hard time pulling the reports out of the program that we get them from. So I don't have a more detailed one than this today. I was hoping that maybe it wouldn't be a huge discrepancy because we don't really have any big differences from this year to next year other than our COVID funding. And some of the increases are just because we're planning on bringing forward some of the staffing changes that we made this year into next year. So we don't have any other really big plans to change anything. All of our other line items have stayed the same.
We don't see what the staffing changes are. We have nothing, just other than that summary total expenditures. And I think
it's our current contact tracing staff and our temporary strategy staff that we added in for this year.
And do you know what caused the increase?
They're not typically in our org chart, and we have a 3%, I think it's 3% increase planned for all of our employees for countywide. That's factored in there.
Hey, Kim, can you hear me?
Jason? Yeah.
This is
you want to step in?
This is Jason. Yeah, sure. This is county administrator from Ozaukee County. So that increase in expenditures is that's the standard operational increases for staffing in the department. So we have a 3% cost of living increase across the board for all county employees. And then we have a 5% increase for health insurance premium across the board. So those are pretty standard things. What we did, obviously, as Kim mentioned in this budget, we're holding the tax levy status quo. We're comfortable doing that for a number of reasons. One is, the inflows of COVID funding from the federal government. And as Kim mentioned, there's $2.5 million that have come in specifically for public health. But the other reason is that the public health department has a pretty substantial fund balance in their department. It's north of $1.5 million. So that's about 3 years of tax levy. So, we think we're really this budget to keep things steady. Increases in expenditures, right? It costs more to have staff year over year. Some supplies might cost a little bit more here and there, but this is largely a status quo budget, and the tax levy is flat. I don't know if the Board of Health knows, but last year we did take some of that excess fund balance and we moved it out of the public health department and into the county coffers, if you will. So on both Ozaukee County and Washington County side. So Washington County took 60% of the transfer, and then Ozaukee County took 40% of that transfer. Public health had a good year financially last year, and they were actually able to increase their fund balance. So they're well situated to have a flat tax levy and go through operations in 2022. So again, kudos to them for doing a great job of managing the bucks.
Well, I do believe, though, when it gets to Washington County, approval through our human services, I think it would be great if you could give us the detail of the budget in Ozaukee County, because I know that last year there were some people who did not approve it because we didn't have any detail. And so now we're comparing last year to this year, and we still don't have detail. So that's what I'm saying is we and me in Washington County in particular, I would like to see the budget that you've prepared for Ozaukee County as a supplemental document coming along with the budget, rather than just 60-40 split.
I'm going to suggest with your questions that you have to start with our finance director, Margie Hammers, and talk to her. She may have the information that you're looking for as well.
I think I just heard him say that the detail is in Ozaukee County.
Yeah, that's how it was set up.
All I'm asking for is that same detail to come over to Washington County as a supplemental document when
I'm certain we can do that. Obviously, this is the first time I've even heard about this issue, but sending the information on should be no issue.
Yeah.
The budget will go to our.
Year.
I don't know about last year. I'm sorry. The budget will go to our Health and Human Services Committee later this month. I think the 23rd is the date, so we'll be preparing that information. And once it's prepared, we will send it over to Margie or Kim or whoever you'd like to receive it, and we'll get it to them.
That would be great. Thanks.
Another thing I just want to point out with the budget coming to the Board of Health, obviously the Board of Health doesn't vote on this budget. I do think it's important for you all to see it. But as Jason just said, it goes to Ozaki's Human Services Committee in the near future. So this has not yet been formally approved by Ozaki County. This is really just for on an informational basis for all of you to know what we're working on. So
Okay.
I will continue giving you updates once it's formally approved as well. And Lois, I will work on trying to get some more detail for Washington County. I remember that meeting very well. Trust me. I would like to repeat that. So we will we'll work towards that.
Thank you very much.
Yeah.
Okay, any other questions on the 2022 budget?
I'm just wondering one thing, this is Doreen. How are the restaurant and inspections going since we've been so busy with COVID and things like that? And
that's a great question. And they've actually been fantastic. We've seen an increase in revenue from facilities this past year. There were a few that we gave a period of grace last year if they weren't operating, so especially pools that were closed all season. We didn't charge them their seasonals last year, and then we didn't charge them, typically if they're closed, we would charge them additional fees to reopen. We didn't charge those this year, but our normal operating typical licensing for the year is actually increased, which is great. And our staff have been able to keep up with the requirements for the test. Or for the
good. So the restaurants are being inspected.
Yes.
Okay, any other questions? All right.
I have one, Chris, just.
Okay, Kathy.
Kim, I think you've been doing a great job, and I'm curious to know what's happening with getting a new health officer. I know there's some interviews going on.
That's a good question, and unfortunately, Jason just dropped off the call. But I can tell you what I know. So I was told by Jason that they were going to be interviewing 3 candidates that were brought to them by the recruiter. Starting, I think, like a week or 2 ago. It was going to stretch out for 3 weeks-ish. They were going to start the interview process and then go from there. And then I believe they go to the county board after the 2 counties agree on somebody. I haven't heard that they're presenting anyone to the board yet, but he was hoping to have someone in place maybe by the end of October. I'm not sure exactly. That's about as much as I know.
Okay, thanks.
All right, it really wasn't an item on our agenda, so I'm not sure we could take it up, but it's there. So anything else from anyone? Okay, then our next meeting date. I don't know what that is.
Oh, I can give it to you. Look at my schedule quick. It's November 12th.
And will that be a Zoom meeting again?
Probably, yeah.
Okay. All right, good. All right, there being no further business before the joint board, we stand adjourned. Thank you, everyone.
Great, thank you. Have a good weekend.
thanks, Kim, for all your hard work.
Thank you.
Yes. How do I get out of here? Leave. Where's leave?